Having your central line put in. This animation shows how a central line is put in. It's also sometimes called a skin-tunneled venous catheter. A central line is a thin, flexible tube that is placed in a vein close to your heart. It's used to give intravenous fluids and medicines like chemotherapy and drugs such as antibiotics. It can also be used to take blood. Having a central line means you don't have to have repeated injections or needles. It stays in until your treatment is over. The central line is put in by a specialist nurse or doctor in hospital. They clean the skin around your neck and chest with antiseptic and then inject local anaesthetic to numb the area. A general anaesthetic can sometimes be used. The central line goes in through a small cut in the skin near your collarbone. The tip of the line is gently threaded into a large vein towards the heart. The other end of the line is then tunnelled under the skin to reach the exit site. The exit site is the place where the tube comes out of your body. Having a line inserted shouldn't hurt because of the local anaesthetic, but it may be slightly uncomfortable and you may feel a bit of tugging. At the end of the central line, there is a needleless connector. The nurses will use this for everything they give you through your central line and for taking blood. After it's inserted, you'll have a chest X-ray to check that the line is in the right place. You will have dressings covering the entry and exit sites. Before you go home, the nurses will show you how to look after your central line. Most people don't have any serious problems with their central line, but problems can include a blockage or infection. If you have any questions about your central line, ask your doctor or nurse. For more information, help, or if you just want to chat, call the Macmillan Support line on 0808 808 0000 or visit macmillan.org.uk.